All right, let's jump right into this explainer on the SASB product safety quantitative metrics for the medical equipment and supplies industry. Since you're joining us, you already know just how highly regulated this sector is. So today, we're cutting straight to the chase. We're going to focus specifically on how your entity needs to track and report compliance data under the SASB framework. We'll break down the exact data points you need to capture so you are fully prepared to disclose your safety metrics with absolute accuracy and transparency.
Here is our agenda for today. We'll cover the product safety mandate, tracking medical product recalls, monitoring adverse event databases, accounting for associated fatalities, and finally, GMP violations and enforcement.
Section 1, the product safety mandate.
Now, what's genuinely fascinating here is this explicit warning straight from the SASB standard itself. It's a stark reminder that product safety failures, whether they come from a clear manufacturing defect or simply an inadequate disclosure of risks, don't just harm patients, they create terrifying financial and reputational risks for your entity. We're not just talking about checking boxes for regulatory compliance here. We're talking about existential risk management.
So why does this matter to us? Well, by keeping a tight grip on these tracking metrics, your entity can actually limit these incidents before they blow up. When you have rock-solid data, you catch issues early, you avoid the nightmare of unfavorable media coverage, and you prevent massive regulatory fines. Ultimately, tracking this data is how you protect both human lives and shareholder value. That is the true mandate behind the numbers we're looking at today.
Section 2, tracking medical product recalls.
The SASB standard doesn't mess around here. It's very strict about definitions. A product safety recall is officially defined as any action taken by your entity to remove a product from the market related to potential or actual adverse health consequences resulting from its prescribed use. And keep in mind, this applies to absolutely all devices manufactured by your entity or your subsidiaries. Here is a massive pitfall you need to avoid. You can't just track government-mandated recalls and call it a day. Your reporting must explicitly include tracking recalls that were initiated voluntarily by your entity too. If you proactively pulled a product off the shelves on your own without a regulatory mandate forcing your hand, that still absolutely counts, and it must be fully disclosed.
So, what exactly do you need to track to stay compliant for this specific metric? Well, you need the sheer total number of recalls and the total number of physical units affected. You've also got the option to disclose the revenues associated with those recalled products from the 12 months prior, which is great for measuring the actual financial impact. Plus, for notable recalls, think massive unit volumes or serious injuries, you must break down the cause, the cost to remedy the issue, the corrective actions you took, and whether the whole thing was voluntary or mandated.
Section 3, monitoring adverse event databases.
For this metric, your entity is required to monitor and disclose all listings associated with your products in any local, regional, or global pharmacovigilance database platforms. Basically, if there's an indication of a potentially serious risk or safety issue and your trade name or product class is flagged out there in a public database, you need to track it. But wait, this brings up a super practical compliance question, right? You might be wondering, how on earth do I report a single defective component that sets off alarm bells across several global databases simultaneously? Do you have to report it 5 times if it shows up in 5 different places? Thankfully, no. The standard gives us a very pragmatic rule here. It clarifies that multiple database listings for the exact same product or a product with a specific component can just be treated and reported as one single listing. This is a huge relief because it prevents your data from being skewed, ensuring your metrics reflect the actual number of unique product issues rather than just how many different databases happen to catch them.
Section 4, accounting for associated fatalities. This metric is as serious as it gets, and the directive is completely uncompromising. You must disclose the absolute total number of fatalities associated with any products your entity manufactures. There is zero room for ambiguity here. It is a hard, quantitative metric that demands total accuracy.
Now, the timing here is where compliance teams often get tripped up. The rule is simple. If the fatality happened this year, it gets tracked this year. It literally doesn't matter if the initial adverse event or the initial use of the product started in a prior reporting period. If the fatal outcome occurred during your current reporting cycle, it goes into your current disclosure.
And you can't just pull a number out of thin air. Your compliance team needs to transparently disclose the exact legal or regulatory adverse event reporting system they use to source this fatality data. It's all about auditability. Stakeholders need to know exactly where these figures are coming from to trust the data.
Section 5, GMP violations and enforcement. First off,
Let's ground ourselves on what we're measuring against. GMP stands for Good Manufacturing Practices. These are the strict safety standards governing the design, monitoring, and control of your facilities and manufacturing processes under applicable laws. Naturally, if these standards start slipping, enforcement actions are going to follow.
The standard lays out a sliding scale of severity for what you actually have to track. It's pretty comprehensive. You have to track everything from basic non-compliance violations found during routine safety inspections and official warning letters, all the way up to physical seizures of your goods, enforced recalls, and even severe court-ordered consent decrees. Every single one of these actions has to be tallied and accurately categorized.
But here's the kicker. You can't just tally up the violations and move on. The SASB standard explicitly demands narrative context. For every single enforcement action, you have to describe the nature and context of the event, and most importantly, the specific corrective actions your entity actually took to fix the process. Did you completely overhaul operations, implement new management workflows, retrain your staff, or maybe invest in new technology? You have to show exactly how you responded.
So, as we wrap up this explainer, I want to leave you with one absolutely critical question. Look at your internal systems right now. Is your current tracking infrastructure genuinely robust enough to seamlessly pull data on mandatory and voluntary recalls, adverse event listings, fatalities, and GMP enforcement actions across all your global facilities? Because if the answer is no, right now is the time to audit your compliance systems and ensure you're fully prepared to meet these rigorous SASB metrics. Thanks so much for diving into this with me.